Good afternoon, everyone. Requesting everyone to take their seats, please. And we can start. Hopefully, I'm audible. Yeah. Okay, I think we are at time and we can start. You crowds can keep walking in. Thank you so much for joining us today here. I would like to start welcoming our speakers who have made the time to be here. Zamir Bray, who leads AI strategy at the Gates Foundation and coordinates an internal AI task force and oversees initiatives focused on equitable, safe AI use for global health and development. Please, would request you to take your seat on the panel. Wasim Hamidoush, who's a principal research scientist at Microsoft's AI for Good lab, specializing in computer vision, NLP, and multimodal AI with a focus on low resource languages. Requesting you to please take your seat. Ilango, who's the World Bank Group Director of Strategy and Operations in the Digital and AI Vice Presidency and also serving as Acting Director for Data and AI. Requesting you to please join the panel. Aisha Walcott, who is a senior staff research scientist and head of Google Research Africa, focused on AI development addressing the continent's most pressing challenges. She holds a PhD in electrical engineering and computer science and holds leadership roles in the IEEE Robotics and Automation Society. Requesting you to please join the panel. Antoine Tesnier, who's a French professor of medicine and entrepreneur, specializing in health innovation and crisis management, and an anesthesiologist at the Georges Pompidou European Hospital. He co-founded Illumins, coordinated France's national COVID response, and since 2021 has served as director of Paris Sante campus. Thank you so much for being here, requesting you to join the panel. And Dr. Alpan Raval, who's chief AI/ML scientist at Vadvani AI, will be moderating today's session. Alpan, requesting you to join the panel, please. Handing it over to you. Yes.
Thank you, everyone, for coming. Requesting those at the back, if you could close the door so that we can reduce the noise a little bit. We can't. Okay. It's full. Okay. Okay, great. Well, if you could just calm down a bit and settle down. Thank you. Welcome to all our esteemed panelists. And our panel, the topic of our panel, as you know, is on small AI for big social impact. I'd like to deeply thank our panelists for making it all the way for the summit and making it to this panel. So what do we mean by small AI? I think different people have different definitions, and we're sort of open to how each panelist chooses to interpret small AI. When we at Vadvani AI brainstormed about this panel, we thought it would reflect, in some ways, the ethos of our own work, making models that are data efficient, that are cheap to run, that sit on the edge, and most importantly, are meaningful to the communities that we serve, which are underserved communities, mostly in rural India. But it's increasingly clear that small AI means a lot more. And I see a lot of people talking about small AI in the summit. More generally, I think it encapsulates any AI that meaningfully impacts individuals while taking into account and respecting their very local context, and rather than providing generic outputs. So anything like that could rightly be called small AI, and we're going to hear from our panelists about their experiences with AI models like that. So with that small introduction, let's now avoid further ado and speak to our panelists. So can you hear me at the back? Yeah, okay. So we can start. I have a common question for every panelist. Each of you represents a different and important aspect of AI work that's happening outside of the mainstream excitement that focuses on large foundation models for a primarily global North audience. Can you tell us briefly about your organization's work and perhaps your thoughts on non-foundation AI models in general? Maybe we can start with Zamir.
Sure. Thanks, Alban. Thanks for including me on this panel. Um, you know, I think that the Gates Foundation. We really see the opportunity for AI to reduce inequality. And our starting point with AI tools is really, does this work? For whom, where, and at what scale? So those are, some of the departing points for us. And so really looking beyond the model of against a benchmark. But how is this going to work in a district hospital in Telangana or a smallholder farmer in Zambia or a classroom in rural Senegal? And part of what we've in some ways got caught up with is the performance of the model on its own. And we've forgotten, how does this fit into the lives and the context that it operates in? And in doing so, part of what we need to think about is who's designing the model and what's it designed for? And I was thinking about the traffic that we've been experiencing the last few days in Delhi. And I thought to myself, would anyone, given the traffic here, design something so big as an aeroplane to try and get across the city? No. Yeah. I think we would design something that's a lot smaller, faster, sharper, cost effective, and gets us from point A to point B without a first class Airbus on our roads.
I think that's a great analogy. Aisha, can you tell us a bit about your work at Google Africa?
Yes, thank you. So I lead our Google Research Africa team. We have 2 sites, one in Ghana and one in Kenya, so representing East and West. But the work that we do is essentially from Africa, for Africa, and the world. Much of our work is scaling from the uniqueness of the continent. Turns out that a lot of the challenges are similar, definitely across the global south and generally worldwide. Our work, so kind of leaning into the next part of your question and thinking about how we approach this type of work, it's very much in line. It's very much problem first. I always say if there's a red button that you can press and it's a 1 or a 0, just build the red button. We don't need to bring AI or technology. So it's really important to be very thoughtful about the type of problem. Coming from Google Research, we want to leverage our compute, our AI expertise and capabilities, and then our mandate, which is the societal impact at scale, to think about the types of problems that we work on. I'll give 2 good examples of those problems. One is around weather nowcasting, which we launched last year across the continent of Africa. So to have much more accurate weather forecasts is absolutely essential, given that much of the continent, and as well as in India, rely on agriculture for labor, right? And we are rain-fed primarily, 95% in Africa. So having much more accurate weather forecasts is essential in that case. And at the same time, on the technical challenges side, we know in North America and in Europe, there's about 300 or so weather radar stations. And in Africa, there's only 37, I believe. You know you can fit both North America and Europe in Africa. So when you think about that, you have to innovate. And so those constraints of the environment that you were alluding to in the intro are part of the motivation of having a research team in the continent. And so that was one way that we innovated and made solutions that were available to the continent. And then the other one is a complementary side, which is working with the ecosystem, working with partners in Africa, including Makerere University, Digital Umuganda, around African languages. And we just released a data set of 21, now 27 voice languages, given that Africa has 2,000 or so languages. This is the start. Most importantly is it's partnership led and driven, and this is, because it's voice, it is about accessibility and about reaching those rural villages as well. So, and enabling the ecosystem to build the solutions from there, whether they're smaller models or larger models. So making that type of data open and available is another way that we are leveraging this notion of smaller AI.
Thank you. Great, great insights. Zamir, can you tell us about your work at Microsoft?
Yeah, thank you.
Sorry.
Wasim.
Yeah, Wasim.
Thank you for the invitation, and it's a great pleasure to be here today. So first, what is AI for Good? AI for Good Lab is the philanthropic research arm of Microsoft. We are employing advanced AI technology to solve real-world problem with real societal impact. This is very important. And how our team and the researcher work, we closely collaborate with NGOs, governments, non-profit organizations, and local communities around the world. And together we are building AI solutions on multiple domains. We are interested about agriculture, food security, healthcare, education, culture, and so on. So this is about AI for Good Lab at Microsoft. Now I am a scientist, so I would like to give you two concrete examples where we use small AI, and also there are two global solutions to tackle global challenges. So they are valid for both. They are valid for both global north and global south. So the first project in biodiversity, it's called Sparrow. Sparrow for solar-powered acoustic and remote recording observation. It is an AI-powered open source solution designed to track and monitor biodiversity in the most remote and hard-to-reach region in the world. So Sparrow is camera tracks with Edge AI model that enable to detect animal species, and these observations are then transmitted using wireless connectivity and satellite, where we don't have infrastructures to transmit this information. And this Sparrow solution is already deployed around the world in many countries. I can cite Colombia, Peru, United States, Tanzania. And it really enables practitioners and the researcher to understand species present and ecosystem changes at scale, supporting more timely and informed decision to protect biodiversity. The second project focuses on wildfires. As you know, wildfires becomes a real threat, global threat with devastating, impacting lives, communities, and ecosystems, and even economies. And around the world, fire wires are increasingly in both frequency and intensity, making early detection and rapid responses more critical than ever. So through Alert California, we are addressing this challenge using AI. So what is Alert California? Alert California is the network of 1,300 cameras operating 24/7. And we are developing AI tools that runs on the top of this infrastructure, enabling to detect early fire. And this will enable emergency responder to act quickly and stop fires before it spread. So Sparrow and Alert California, as I said, there are two global solutions for global problems that can be deployed anywhere around the world, and we are providing them open source that anyone can embrace them and deploy them.
Thank you, Wes. Antoine, I think you're the only member of this group that doesn't work in the Global South. So if you tell us a bit about the work at Parisante and how you're using maybe non-foundation models in your
Right.
health work.
Well, thank you, Alpen, for this invitation. I'm happy to be the outsider of the panel. I'm working actually in healthcare, and I'm leading a new kind of innovation ecosystem for healthcare, where we gather researchers, doctors, patients, startups, and industrial together, as well as institutions. So the idea is to really create a whole community of innovation and engage into the use of data and artificial intelligence. And healthcare is probably one of the field where AI has a long-standing history, and the world has discovered AI with the rise of Gen AI. But there were a number of small AI models designed for a long time, and this is why we already have a number of validated tools that we can use in healthcare, answering the question not only does it work, but is it reliable, which is very important for our patients. So before we have the proof of efficiency of LLMs in the medical field, which is not fully clear yet, we use machine learning tools, which are actually small AI models, in very specific areas. What actually works really nice today is the image analysis or pattern analysis. So you can think of radiology, for example, chest X-ray or fractures in the emergency room are fully analyzed by small AI models and small AI tools that are easily deployable on small computers. You can also think of picture analysis in dermatology, in ophthalmology, etc. So these are very concrete examples of already validated small AI models in healthcare that are used on a daily basis, at least in France and Europe. We'll get back in the discussions on how we need data efficacy on this topic, but it's really important to understand that these models are already deployable, and some of them can actually work offline, which is really important in some environments.
Thank you. Ilango, from a World Bank perspective, what is your view on these types of models?
Thank you very much for the opportunity to be here. Coming right at the end, I don't know what new things I can say, but to basically reinforce the messages that have been said. For us at the World Bank, we see AI as a means to an end, and very much our AI agenda is shaped by the mission of the World Bank, which is to reduce poverty and grow prosperity in the world. And when you take that lens and you apply it, we have to keep it simple. Not all countries have the ability to have the compute power, the electricity, the talent, and the data. So therefore, taking on tested small AI applications to scale and replicating them around the world is something that we see as a mission priority. So in that respect, what Wadhwani AI is doing here is pioneering, and this what I've heard this morning from Dr. Sunil Wadhwani himself about what you're doing in TB, what you're doing in outer school children. This is all tremendous, and it has great potential for application. And often what happens is we focus a lot on pilots, and then what happens, the pilots tend to kind of, once the sheen wears off, people forget the pilot. I think what we need to do is, and what we are doing at the World Bank is to see those pilots, whether it's in health, education, or agriculture, on the small AI setting. It works in rural communities, where offline, where data is not that rich, talent is not readily available, and it can also not require a lot of electricity. It's plug and play. Then how do we get the right KPIs, which then allows us to go from a village of community of 50 villages to a larger population center, and to see how best we can help them, say in agriculture, to improve productivity through better inputs, as we are now working in UP in partnership with Google, and we are doing the same thing in Maharashtra. Household income, the inputs get better, and to see how they can access the markets and agriculture credit. Similar in health and education, we've seen great practices that we are seeing in Africa, in Ghana, in Kenya. So how do we take these models and replicate it? So I'd like to assure everybody, and this is something people think small AI is inferior. No. It's not second class. No. Small AI can solve problems. It means to an end. And if it can actually fast track development outcomes. You know, we've known the problems with Millennium Development Goals, we've known the problems with Sustainable Development Goals, and many countries are lagging behind. And this is an opportunity where this development technology, if it can be put to use in the right context, in the right way, I think we can achieve faster development outcomes.
Thank you. That's really interesting. Aisha, I'm going to come back to you and ask you more specifically, how does the work that Google Research does in Africa impact rural communities specifically? How does one bring the benefits of technologies like these big foundation models to devices that may only have patchy internet and supply very little data?
Yeah, thanks. That was a loaded question, huh? It's two parts there. So I think, so first and foremost, in general, just approaching these challenges with humility and relating. So I always start with, you know, I'm a scientist, but I'm also a mother, right? And that's a thread that binds so many of us. When you think of that, you also think a lot of the solutions that we're building, it's not for them, it's for us. I'm using the same health systems that you all are developing interesting tools and models for, you know, and we have many of the challenges around weather as well. So I think the first thing is to kind of have that base human layer as we think about our work and to connect with those communities, whether they're rural or urban, right? A lot of the work that we do, we're looking at, you know, these large populations that, you know, if you think about agriculture, for example, where it has a large part of the labor force, you know, there's many different ways that this is, you know, people are a part of that value chain, whether they're actually doing the growing or providing the inputs and or making those decisions and the risks along the way. So that relationship of getting out in the community is a very important part of work that we do, is to connect with those. And then really think about, you know, kind of coming home as Google Research, you know, where is our unique value proposition? We're not necessarily going to solve this full problem alone. Usually it requires, you know, behavior change, policy, and many pieces of the puzzle. How do we best fit our role? And we do this in co-creation with partnerships. So that's kind of the second layer of fabric on how we reach these rural communities. And then on the other side of the question.
Sorry, do you have an example of that?
Oh, yeah, absolutely. So if you think about, okay, I'll do two ways. So, for example, the languages work that I was talking about, Wahal, and Wahal is a word, it's a Senegalese word that, it's Wolof, that means to speak. And the way we wanted to create this is, it's not from us, it's for the community. So if you have partners who are across the continent, let them be a part of the process of collecting the data, of understanding their language and their local context to get these high quality data sets. And so I think being partnership driven and knowing our role and our place was what was very successful for that. And then the last point I'll just say on the second question that you threw in there is really our open models, our open weight models, Gemma, are made for a lot of these solutions that are more closer to the edge. So we have nano models that can run on your laptop and tablets and so forth, and we take advantage of those new technologies for our communities.
Do you actually use them in Africa?
Oh, yeah, yes, yes.
Great. Zamir, the next question is for you. Much of your work at the foundation is about reducing inequities through promoting safe and responsible use of AI. So what role in your view do small and custom AI models have to play in this? And if you can provide examples, that would be great.
Yeah, sure, Open. You know, I think I do want to just touch a little bit on the issue of reliability, because my colleague over here, you know, spoke about it, and I think it's a critical issue. I'm sorry if I'm going to repeat this example from one of my previous panels. But I asked the audience, Alpan, because I'm going to be on a plane later, so it's a bad idea, but I asked the audience anyway. If I said to you, the plane has a high probability of leaving Delhi and landing safely, wherever that's going to be, and that probability was 95%, would you get on that plane? 99%? No? No. I did have one guy that he kind of thought about it and he said no. and the point there is that I do think we got to work towards models that have zero error, right? So much so that I think that we are trying to wrap our heads around, is there a concept of verifiable AI where it shifts the narrative from a black box to a glass box. It actually exposes the logic. So for a particular set of inputs, you can follow the logic chain and it gives you a set of outputs that you can really track. You can audit, you can see it that it's repeatable, and you can prevent some of the kind of fundamental errors that we start to see. I think, in the, and I want to go back to a very real example, Alpan, because when I think about small models, I'm coming back to the user, the community healthcare worker that tried to help a mother.
Yeah.
And we have one of our grantees who shared this very personal story of a first-time mother who presented, she was 6 months pregnant, and she said her hands and her feet started to get swollen. And the community healthcare worker looked and said, "You're pregnant, this is normal." 4 weeks later, she started having a headache and blurred vision. I think colleagues will know where the story goes. Unfortunately, that mother had severe gestational proteinuric hypertension. It was missed. And the mother and the baby didn't make it. But in that moment, what inspired our grantee was if the community healthcare worker had a small model that worked on her device, which was a low kind of cost smartphone, still had patchy internet, but was just built small enough to help her to make good decisions at that point of care, we actually would be sitting with a very different outcome today. And so I think small models present us those kinds of opportunities.
Very interesting, very good points. Wasim, you spoke about, in a general sense about the research done at the AI for Good lab at Microsoft. Again, are there specific examples from your work where you see the benefits of building domain-specific models to realize impact? And are there research lessons that we can take away from this? I think it would be good for the audience and us to understand what are the sort of research directions of the future that can come out of this work.
Yes, I would like to start with a report that Microsoft has released recently about AI diffusions. And this report showed clearly that there is a gap in the AI diffusion between global north and global south. But more importantly, they highlighted 3 pillars that can accelerate the AI diffusion in the global south. And these 3 pillars are access to electricity, access to connectivity, and access to AI tools in the local languages. And we have been working on this 3rd pillar, which is access to AI on local languages. And we have released recently research works called BYOL, Bring Your Own Language Model into LLM. So this paper provides the best recipes and practices to select the best existing open weights LLM, and we have been focusing on small foundation models from 4 billion to 15 billion. And once we select the best LLM for one target language, we do all these recipes to boost the performance for these low resource languages. But I wanted to get back to all the challenges we are facing for these low resource languages. So when we train these foundation models, we train them on internet data. And internet data represented by more than 60% is English. and followed by some high resource languages like French, Mandarin, Portuguese, etc. So these low resource languages, even if they represent more than 7,000 languages, they represent only a tiny portion of internet data. This is the first challenge. And the second one is the benchmarks. When we build LLM, we benchmarks them, we evaluate the performance on benchmarks. And we have seen like there are only at least one benchmarks for only 300 languages. So we can see like more than 6,000 or 7,000, they don't have even one benchmarks. And even in these 300 benchmarks, most of them are just translation from English to this low resource language. So they have nothing to do with the culture and the context of these languages. And the third challenge is the performance gap. Of course, there is a performance gap between, for these LLMs, even the frontier models, between high resource and low resource languages. And the fourth one is safety. So when we build LLM, usually we do some safety alignment with the reinforcement learning, but this safety are mainly done in English and some of high resource languages. Now, when we build LLM for low resource languages, it becomes very strong for these low resource languages. It raises some other issues with safety. So we have to evaluate these LLMs for safety on this language and do all these alignments, reinforcement learning in the target language also. So in this PO, we addressed some of these challenges, and we have been targeting three pilot languages, which are Inuktitut, spoken in north of Canada, indigenous language, Chichewa in Malawi in Africa, and Maori in New Zealand. Why we have selected these three languages? Just because we have access to local community to help us to get data. So we gathered data from this community, then we used some continual pre-training, instruction fine-tuning to boost the performance of open weights LLM, and we were able to gain 12% pounds gain, closing the gap with English. So now what's next steps? Actually, we are trying to expand this to more languages. We have some collaboration, for example, in North America with Paraguay to develop LLM for Guarani, and we want to extend this to other languages. But most importantly, we have launched an initiative called Lingua Europe to fund data collection in Europe for 10 low resource languages in Europe. It was released in last September. It was very successful. We have received many applications and 10 have been selected, and now we will start working with them. And it was that successful that now we are extending this initiative to Africa through Lingua Africa. It has been announced just today in the AI Summit, and we will be allocating 5.5 million to support data collection for African languages. And this is in partnership with Gates Foundation and Microsoft AI for Good and FCDU. And this initiative will be led by Masakani, African Languages Hub.
So, sorry, just to follow up. So, for people who are working on these small language models or domain-specific language models, even, say for healthcare domain or some other domain, are there, strategies that they should pursue that you can recommend?
Yeah, this is very important, and this is also related to the call for Lingua Africa, because many efforts have been done in the past to collect general purpose data. Now we have enough, I think, general purpose data, but when we evaluate this, the performance of these AI tools for application specific, for example, healthcare, education, agriculture, they don't work as we want, as expected. So what we want today is rather than, instead of focusing on general data collection, we will be focusing on domain-specific, application-specific, use case-specific data collections and building AI tools for specific domains, at least for this all reliability issues. We will have a model that performs good in that target low resource language in that application that we can deploy and we can be used by local communities. This is really a priority for the next steps.
Thank you. Ilango, let me come to you. You have vast experience in international development. Can you give us a view of the future as it relates to using AI for developmental goals? Do you think AI will have a meaningful role to play in transition of emerging economies to advanced economies?
Yeah, so I do think the prospects are good. And our North Star is job creation. And so we need to support countries that AI doesn't automate jobs away, but AI actually supports the creation and enhancement of jobs. And this is where small AI becomes imperative, unlike the foundation models, which will have implications. So the second is, how are we going to go about it? And in some sense, whether it's large language models or small AI solutions, you need an ecosystem. And that ecosystem needs to be powered by the local private sector. And often what we see even now, whether the AI revolution is before us or not, small enterprises, whether in the SME space or in the larger space, struggle for a variety of reasons. And if the countries don't reform business processes, make it easier for permitting, which AI can do, you're going to see that AI actually is not going to play an effective role. So there are some fundamental reforms, and this is where some of the foundational investment in DPI, the digital public infrastructure, needs to happen to create that ecosystem and the ability for the ecosystem to then work with the private sector, local communities, to be able to create those jobs. And this is what we are seeing everywhere. If that happens, and here too you see this whole vibrancy around the startup ecosystem is why? Because everyone, the young people, see opportunities, and this momentum can drive everywhere in the world, whether it be in India, whether it be rest of South Asia or Africa, or Latin America, even in the Pacific region. So how do you go about it? And what we did was we joined hands with a number of multilateral development banks, and in the last couple of days we launched this small AI use case repository. It's about 100 cases. It explains in health, education, and agriculture, and job creation, how AI can be leveraged to the maximum advantage of communities, both in terms of service delivery, productivity gains, household income gains. All this eventually leads to better jobs, better employment, and better income prospects. So we are very much upbeat about small AI, but I do take the point about the community trust. If once it fails, the community is not going to believe it. So it's very important that whatever we put in place, work with others, partners, including whether it be MDBs or Microsoft, Google, Gates, and everyone, we have to ensure that whatever we leave behind in small communities is something trustworthy, reliable, and it doesn't, end of the day, hallucinate and gives them something that the farmer struggles and ends up with other challenges.
Thank you. So this report you mentioned, is it open access?
It's on the World Bank, we are hosting it. It's called AI Repository. Just type and you'll be able to access it. It's got 100. And we'll continue to update this. And once we are able to sort out some legal issues, then we'll also allow anyone to submit their use case repository, obviously. Into the repository, obviously, we'll go through a filtering process to ensure that the right ones are there.
Great, thank you. Antoine, coming to you. You head an organization that uses AI to advance health outcomes through research and commercialization. Are data efficient and hardware integrated AI models important for the work that's happening at Parisante? And do you see these models as sort of potentially being deployed in low and middle income countries like India?
Yes, well, so clearly they're very important for us for different reasons. Of course, we'll get back to the scalability and the use in low and middle income countries. But at first, what is the reality in healthcare is that data is scarce and siloed. And so you need to work on what you have, actually. So sometimes it's large set of data, sometimes it's very small set of data, but you need to have tools that allow you to build relevant algorithm and relevant analysis on small data sets. And in the meantime, of course, we're building larger data sets. Sometimes it's at a level of one department in one hospital, sometimes it's one hospital, sometimes it's a group of hospitals. At the end, what we are reaching out in Europe is the constitution of a large European health data space. 450 million citizens joining their health data in digital public infrastructure organized in 27 countries, which will be a world premiere. But in the meantime, you need to work on that reality of scarce data. Second thing is that not only data is limited, but also when you want to enter the new revolution in medicine, which is what we call precision medicine, personalized medicine, you need to work on very efficient algorithm because they need to adapt to one person and not only to a whole population. So you need also to get that into account in building the algorithm. The last thing is that you also have to work with what is existing in the healthcare systems, which is sometimes not supercomputers or high calculation power that exist in servers remotely, but when you're in a room of a patient or working with in a hospitals, it's very simple computer, and you need to have efficient algorithm and tools that you can have running on that kind of computers. And so, of course, you go all the way to a smartphone at some point if you go into remote areas. So this is why we actually work on this kind of approach, making sure that, of course, we have research on LLMs and large computing power, but we also have this work on small data, very efficient algorithm.
Can you give examples?
Well, yes, I mean, I already gave some examples about radiology. We are able to have a radiology algorithm running on small computer machine. And getting back to your example, which I think is really important, it provides me the opportunity to point out two very important facts. One is that the AI that we use is providing information. It's not making decision in healthcare. So of course we target high level of reliability, but at the end it's a human decision, and this is very important, I think. Second one is that we've been trying to compare the performance of the algorithm that we've been designing with the existing performance, and of course you're reaching to 99.999%, etc. But what very few people actually know is that the actual performance of what we do at the moment is not 99.99999%. So most of the time, and I won't say the numbers, but most of the times it's actually better than what we have. And this is really important in your example. Is it good enough compared to what we can actually do at the moment? And I think it's particularly important in low and middle income countries because very simple solution, offline LLMs, etc., can solve many issues.
Alban, can I pick up quickly?
Yes, please.
I think it's really important, and actually I'm going to name the number if it's okay. So a really important World Bank study from a few years back showed that on a set of 5 very simple conditions, the diagnostic accuracy was 50% across 8 countries. 50%.
What illnesses are we talking about?
Acute diarrhea, upper respiratory tract infection, maternal hypertension. And the point about that is, I don't think any of us would be happy to, with 50%, the equivalent of tossing a coin and saying that's okay, right? And so I completely understand that today there's a big gap between what the models can offer. And I think the question about are the models performing better than the average clinician, that's done.
So, sorry, I can't resist a follow-up question. So often you find that average accuracy of models is far better, but models seem to fail more unpredictably than humans. At least that's sort of the understanding in healthcare. Do you agree with that, or do you think that's not true? Anyone who wants to answer this.
Well, so I think we need another hour to discuss this because, so what you say is absolutely true, but then you need to look at every pathology or every symptoms that you're looking, because the performance of diagnostic can be a little bit higher in certain places, in certain situations, a little bit lower, etc. But we get to the same point, which is what we are building is actually better than what we are able to do at the moment. And what we show in the scientific literature is that actually the combination between algorithm and natural intelligence, I would say the doctor, is actually the best tool so far. So the question, getting back to your question, how do we deploy this in low and middle income countries? I think it's really important. We need to have models that are able to run on small devices, that are able to run offline. And sometimes it's a very limited set of data, very limited set of algorithm. But we were actually discussing in Paris about examples of remote LLM providing answer on 10 most important questions for healthcare in low and middle income countries. That doesn't need LLMs online with super calculation power. So that's one first point, edge native AI. We also need to have data efficient learning systems because most of the time in low and middle income countries we have a limited amount of data available. So this is what I discussed earlier.
We have a lot of data in India, but it's very tends
Yes,
to be
but,
noisy.
but we need to get the time to actually get them together, clean them, and get them prepared for a robust analysis. So I know you are leapfrogging and going very fast, but by the time you will scale, this will create a real power of analysis. And then we need also to understand how we can couple hardware with software and algorithm to design reduced costs so that they can very easily scale.
Great, there's fantastic insights. I'd actually like to give some time to the audience to ask questions to our panelists. So, yes, please. Yes.
Thank you very much. I'm Harish Kumar from the CSC Innovation Center on Solar Energy, particularly based on. I belong to Rajasthan. Question to World Bank President. Very thanks to the World Bank. In Rajasthan, 60% population rural areas, and totally based on the agricultural domain. 40% population in the youth. So how World Bank increase the capacity of AI application to the youth as well as agricultural domain, so the economics changes, more productivity, more economy, more inclusion in climate change and renewable energy domain.
Thank you for that question, which I think is a very foundational question to ask any policymaker in terms of what kind of an AI strategy or implementation you want to have at any geography in the world. So obviously the first thing is you need digital literacy. Second, you need to skill up so that everybody is upskilled and reskilled on AI related capabilities. Third is improving the STEM capability in schools and universities. So you do create a future cadre of people who can work on these topics. And then the sectors you mentioned, which are our priorities: agriculture, health, and education. Obviously, this is where we see the greatest potential for small AI. But particularly on Rajasthan, right now I don't have any information, but I'm happy to share that with you. But certainly we are working across different states in India like we're doing elsewhere in the world. And we do prioritize literacies, skilling, STEM, and applications in priority sectors like agriculture, health, and education. But having said that, I also want to say one point, just to respond to devices that can do computing. Devices are expensive for the bottom 40%.
Rajasthan has solar domain state.
Yeah.
Maximum solar radiation in Rajasthan. How do we quantify the by AI advantage properly?
Yeah.
Hi, my name is Selena. I'm the CEO and co-founder of Zindi. We run competitions to develop models, especially in Africa. And I actually had a question for Wasim about kind of the technical implications, the size implications, the practicality of using open source, open weight models, large language models to train very specific, domain specific, language, under-resourced language models. How have you seen that play out?
Yeah, I think what we have seen, the selection of the base model is very important. because what is true, what is real, that we cannot train from scratch an LLM, even if small or large language model. We cannot train it from scratch for low resource languages because we don't have this 15 trillion tokens to train. So it is very important to select the best multilingual model that has the right tokenizer that can be adapted to many low resource languages. This is very important. And then get the data that we need. And what we have seen also, monolingual data helps, but also bilingual data can help, and also translating English into this low resource into this low resource language can also help to boost the performance. So in our paper, we are providing all these recipes to follow to get the best boost in terms of performance. What I would like to add also, like with all these low resource languages we have, text cannot solve them all. Like many of these languages will be solved by speech, is very important. Like ISR model, speech to text, text to speech, will build a very large role into unlocking all these low resource languages in addition to LLM that can operate into the low resource language or in English.
I think we have time for one really short question.
Hi, this is Dr. Ravi Singh. I'm from Miami, and it was a great panel, so a lot of great insights. It's for Google, Microsoft, and the World Bank. Here's the scenario. If there's compliance across all of these platforms, which platform will win the AI wars?
That's a loaded question. Anyone want to answer?
I'm not. So first of all, I think healthy competition is how we've been able to develop incredible technologies just over time. So the competition is healthy, and this is great. I don't see it as a zero-sum game. There's too many people on the planet, and there's too many challenging, unique problems that need to be solved. So if we're making it useful and bringing joy and happiness for all, that's in the, I just love it, that's in the theme here, then it's not necessarily going to be who wins whatever platform. It's what is relevant to the context of the end user. So taking it back to a more like human, personal perspective. That's my thinking.
I think 3 billion people are offline, so there is space for everybody to compete. Second, in health sector alone, 3.5 billion people don't have access to healthcare, so there is enough scope for all kinds of applications.
Just I want to add, many people have been asked me to, if this all efforts we are doing for low resource languages, if it is enough to make this model as good as English. I would say maybe not, but without all these efforts, we will never reach this objective. So we have all these collective efforts will get us to this objective.
So you actually use some of Google technology.
Thank you so much, everyone. I'll now like to invite Neha Vats, Associate Director, Human Resources, to just hand out the mementos to all our speakers. And we'll just take one group photo, please. Requesting the speakers to just take one group photo, please. Thank you so much, everyone. Thank you, everyone, for joining.